While South Koreans are living longer than ever before, individual perceptions of health in the ROK do not live up to those standards. As new data from the OECD shows, South Koreans consistently underreport their health. I spoke with an OECD health researcher to find out why.
My name is Gaetan Lafortune. I'm working in the OECD Health Division. I'm responsible at the OECD for the database on health statistics, and I'm also the coordinator of our publication, Health at a Glance. In 1970, the life expectancy of Koreans was about 8 or 9 years below the OECD average. But because there have been the huge gains over the past few decades, like now the life expectancy of Koreans is in fact more than 1 year above the OECD average. And that's due to a number of factors, like increasing, obviously, economic development and standards of living, better education levels, better lifestyles, also a reduction in some risk factors to health, including reduction in smoking to some extent, although there's still some progress to be achieved on that front, particularly for men. And also better access to health services, which with the universal health coverage being developed and implemented over the past few decades. So it compares very well on that front in terms of how long people live. Koreans are now among the top group of OECD countries.
And despite South Korea's recent surge in lifespan, the perception South Koreans have of their own health is still catching up.
This is a bit of an intriguing fact, which is that which we see for both South Korea and also Japan, because Japan also has a very high life expectancy. But when you ask people in both Japan and South Korea, how good is your health? You will only have about 30-35% who will say that they are in good or very good health. And then you will have 50% of the people will say that, well, their health is okay, not bad, but not good either. So both Korea and Japan have the lowest percentage of people reporting to be in good health. So that's that seems a bit contradictory with the good track record in terms of life expectancy. But there are various factors that come into play in how people respond to these questions. First, it matters, of course, in which health status they are and whether they are in good health. But there's also a cultural factor that play into this, and there's a fair bit of research that shows that people in Korea, but also in other Asian countries, tend to select more the sort of the middle response category in this case, not so good and health and not so bad health. So it also reflects a bit of a cultural factor in how people respond to these type of questions.
Despite the ROK's low subjective health score, OECD health researcher Gaetan Lafortune says South Koreans are still in a better health position than if those statistics were reversed.
The paradoxical result in Korea, we can compare it with the United States, for instance. In the United States, life expectancy is about 2 years shorter than in the OECD average, which means 3 years shorter than in South Korea. But at the same time, when you ask Americans, how good is your health? People in the U.S. are very enthusiastic. Americans are very enthusiastic, and about 90% of the people will say that they are in very good health. But even so, they die from different type of causes of death. They die on average younger than in Korea. So in this indicator of self-rated health, there's it's a mixture of an indication of the health status of people who are responding to the question, but there's also a big cultural factor that play into these survey responses.
I also spoke with a German researcher based in the Northeast United States to learn more about what causes such a large difference between a country's average lifespan and the reported subjective health measurement of its citizens.
I am Corina Lockenhoff. I am an associate professor of human development at Cornell University and also an associate professor of gerontology in medicine at Weill Cornell Medical College. One huge element in terms of people evaluating their own standing is how they compare themselves to others. So we found that depending on whether people are given a comparison target to which to compare their own health, or whether they're not given any specific target, people's health ratings really differ quite dramatically. So, for example, in Western samples, if you ask people across the lifespan to rate their health, then health goes down with age. But if you ask people to compare their own health to others of their age group, it remains more or less stable. So depending what comparison group people choose, they may rate themselves worse or better. So now it could be that people in Korea tend to choose a comparison group that is more aspirational. So they may choose a group who is doing better than themselves. And so they may aspire to achieve that status, but that has benefits in terms of motivation because it gives you something to strive for, but it also leads you to evaluate your own health less favorably. So that could be one possibility.
Dr. Lockenhoff also says that overly positive campaigns of elderly people's lifestyle can actually lower someone's opinion of their own health when they fail to measure up to health campaigns.
In an effort to engage older adults to be more active, some governments have made efforts to start public information campaigns that feature very positive views of aging. And one study that was coming out of Hong Kong, conducted by Helene Fang and some others, has found that these extremely positive views of aging that are sometimes promoted in an effort to get people to become more active can actually backfire because they may no longer be seen as attainable. They may be so positive that people feel that now I see this old man here running a marathon and I'm only going walking around the block every evening, so maybe I'm doing something wrong. It is very difficult to change people's opinions of aging because they develop very early in life. At about the same time that people figure out that they're men and women, they start to realize that people age and they develop views of aging. So it is not something that can be changed very quickly, but you can slowly adjust societal narratives about aging. And again, this needs to be done carefully. So just putting an overly positive narrative out there is not necessarily the best approach, but instead having realistic views of aging that emphasize the remaining abilities and acknowledge some of the limitations, I think is probably the best approach.
For KoreaFM.net, I'm Chance Dorland.